Well, tonight, a story about being in the right place at the right time, and also a warning for those who may be traveling this summer. Senior health correspondent Monica Robbins joins us with a story of how a nurse saved a woman's life, Monica, while both were on vacation, and also the valuable lesson learned in all of this.
Yeah, they really are valuable lessons. Stacey Mazzurco is a nurse, but also the director of one of the directors at Harrington Heart and Vascular Center at University Hospital's Cleveland Medical Center. Last summer, she was on vacation in Riviera Maya, Mexico, when a chance encounter changed a lot of lives.
Two families on vacation in Riviera Maya, Mexico. The Hartleys trying to recreate a photo from an old vacation. Stacey Mazzurco, a cardiac nurse from Cleveland, happened to be sitting nearby and helped. Then sometime later, Stacey noticed something very wrong with Rita, the family matriarch.
Something wasn't right, so I ran over there and I knew immediately that she had a stroke.
Stacey called for help and started assessing Rita, but the resort medical team kept their distance.
I think they really thought she had too many margaritas. I did get them to get me a blood pressure cuff, and her blood pressure was like 200/120.
She really took charge of everything that was going on because those, unfortunately, those medical professionals were not really trained to really help her. They were struggling to get her pulse.
Stacey knew time is brain loss, and it seemed to take forever for a squad to arrive. Then there was a 45-minute ride to the nearest hospital.
Probably the most challenging and hardest thing I've ever done as a nurse.
She stayed in touch with the family through Rita's hospital stay and their trip back to the States. Fortunately, Rita recovered with just minor issues left behind.
So I feel like I had angels looking over me from the beginning.
The family, so touched by Stacey's involvement, nominated her for a National Daisy Award that recognizes extraordinary nurses. Stacey won. Both families now prepare for the unexpected on the next vacation.
As a mom, you're always thinking of what happens to other people, and it kind of doesn't enter your mind what might happen to yourself.
Both families stress the importance of making sure everyone knows what types of medication your travel partner is taking, and do your due diligence on the resort. Do they have an AED and other basic first aid items? A doctor on staff that you don't have to pay first before treatment? How close is the nearest hospital, and how long will it take a squad to arrive at the resort? This was a nicer resort. Neither Stacey nor the family from Missouri ever thought they would go through what they did. And the doctor who stood by and did nothing was requesting $475 from the family before he would step in to help. Stacey was so infuriated by this, she reported him to the Mexican Medical Board.
What a story, but it's really a good reminder when you're traveling, even know the emergency number.
Yeah.
911, it's different in other countries.
Absolutely.
All stuff that you should plan ahead of time. That's a good reminder.
And what some things seem outrageous may be normal in that country as well.
100%. Mom, thanks so much.
Sure.